Hi, I'm Randy Neiswonger, CEO of Community Hospital. Welcome to this edition of Community Beat. Today I have Dr. Gupta. Dr. Gupta, thank you so much for joining us. Can you tell the viewing audience about what you do here for Community Hospital Powers Health?
Sure. So I am a neurologist. I've been here for over 15 years. In part of neurology, we have subspecialties. One of my subspecialties is epilepsy, which is the treatment of seizures.
Yeah.
I also treat other neurological conditions.
And I absolutely love the contribution that you provide to our organization. One of the aspects of neuroscience and one of the larger aspects that inflict on the community is truly seizure and epilepsy. So we have something called the EMU. Can you tell the viewing audience of what is the EMU?
The EMU stands for Epilepsy Monitoring Unit, and it is a dedicated unit to provide services in this area to monitor patients who may have spells or seizures. We use this for diagnostic purposes. Sometimes there are folks that we know have epilepsy or seizures, and we're trying to monitor them for medication treatment changes. Other folks we do monitor for diagnostic purposes. Oftentimes people have spells. They come into the hospital or report spells to their physicians where they've lost awareness or have staring episodes, and we're not really sure what they are. And so part of that workup can include a monitoring stay to further evaluate to see if seizures might be a possibility.
How do patients that may have epilepsy get to need the EMU or get in access to somebody that could let them know, hey, you know what, we need to monitor you? What is the process?
So typically we don't go from initial, I have these symptoms to the EMU. There are several steps in between. Generally, our great primary care providers are the basis of the testing and the referrals to the neurologist if they've had a cardiac workup and everything looks okay, and the physicians feel that there is something going on. Certainly, they contact us or refer, and then as a neurology team, we see the patients in the clinic. And if we determine that a longer EEG monitoring is necessary, that's when they get referred to the EMU. We do also do outpatient EEG, which is usually the first step in this, which is a routine 20 to 30 minute study. We also offer long-term home monitoring. So there are other ways to check an EEG, but the EMU is reserved for folks that really need longer, real-time monitoring with a video camera and a tech, so we can monitor what the spells really are.
And an EEG is?
An EEG is, in long story short, we call it a brainwave study. It's like an EKG for the brain. It monitors electrical activity on the brain, and if you do have a history of seizures or potential for seizures, you can see not only what we call sharp activity, which is irritable areas on the brain, but also you could also record, possibly some seizures.
In what age spectrum do we typically treat here?
So right now we're adult, 18 and over when it comes to our EMU. Certainly we do see some teens. We are not currently seeing pediatric patients. We would probably require a pediatric neurologist for that, but possibly in the future.
Okay, well that's important, right? Because we know that sometimes seizure activity starts in adolescence and then moves into maybe a more progressive disease. And seizures are very serious underlying condition. I know that there's been notable progress in treatment of seizures, but still yet a very serious issue.
Absolutely, and in our patient population, besides folks that are maybe genetically predispositioned to have seizures or seizures from childhood, a bulk of adult patients do kind of go over with other things like history of tumors, strokes, head injuries. There are also a bulk of patients that we see that have developed seizures as they got older.
Yeah, well, thank you so much for educating the community on a service that we have that not many people know about, and it's a vital element of care within this patient population, this very vulnerable patient population.
Absolutely.
Thank you so much for joining us.
You're welcome.
And we're going to see you guys next time on Community Beat.